Hello, everyone. Dr. Stillman here today with Jim Laird to discuss how to become a patient at my practice, which is really, I feel, more our practice. We've got a whole team. I want to explain first what the process to become a patient is and why I set the process up the way that I did. So first of all, when you apply for consultation at the medical practice, you will be able to schedule a discovery call. This is a complimentary 15 to 20-minute call where we just make sure that we're a good fit to work together and that your goals are something that we can actually help you to achieve. The second step in the process is what we call a practice membership evaluation. Why do we have this appointment? It's a $95 call right now anyway, and I don't anticipate I'm going to change it, but it may change in the future, which is a very low price, frankly, for an initial consult at a functional medicine practice. The reason that I created this call was that we had people coming into the practice who either had unrealistic expectations or weren't really sure which of our offerings was right for them. And this practice evaluation allows us to actually get to know people so we can make a rational, intelligent decision. And most of all, we can align on what we value, what our goals are, where you'd like to be in 3, 6 months, 12 months, as well as what's realistic to expect. I've found that a lot of people are very disillusioned in not only the conventional medical world, but also the integrative and functional medical world, because they've frankly been overpromised by people in the past. They've been told, you've just got to follow this blueprint or just do this plan and everything's going to work out. This is not some fantasy world where 100% of people get better. Sorry if that bursts your bubble or rains on your parade, but it's just a simple fact that I've discovered, in life is just true. So I created this appointment so that people could actually get clarity on what's realistic for them to expect, and then what's it going to take for us to have a good chance of getting there. And I feel like this is a very authentic, very genuine, very honest way of offering our services that allows people to really explore whether or not this is a good fit for them. Now, we're going to get into in a minute what exactly the offerings are, because this is another sticking point I've found in practice, is that people sometimes don't really understand why it takes what it takes to get the results that they're looking for in terms of their functional medical care. So that, real quick, is the basic overview of our onboarding process. And I'll add that after the practice membership evaluation, there's a call where we schedule a certain number of appointments depending upon the length of the engagement. You'll be onboarded to our electronic medical record, how we work with people, how to schedule appointments. All of that, my team will walk you through so that you don't ever feel like you don't have someone to ask a question of, you can't get support. I really care about, and I've built into our services, what I think is really a tremendous amount of support. You have chat portal access that we generally get back to you within 1 to 3 business days. You've got access to multiple staff members via email, everything from ordering supplements to lab testing. Someone will email you, send you a protocol through the electronic medical record, or even get on the phone with you if you've got questions, so that you really don't have any reason to not succeed. And so you frankly feel really well taken care of. And I'm going to get into what our programs and memberships are in a minute. But Jim, before I move on to that, anything you want to add to what we've created in the onboarding process?
Yeah, one of the reasons we're on here today is to basically get you to understand the onboarding process. Most people don't understand, like for me in my gym business, the training of the people wasn't the hard part. The hard part was the tracking of people, the admin, the scheduling. That's the most difficult part. And when you're building a team, so if we can educate you on what our onboarding process looks like, and then also we're very upfront, we will send you the prices in advance so you can see if this is something that lines up with what you're doing. By doing that, not only do we make the process easier for you, is what we want, it also makes the process easier for our staff, which allows us to also keep costs down, because I've been working with you now for almost 2 years. And that is something that you were very, as someone who did very high-end concierge, medicine. And I also trained professional athletes and people that could spend a lot of money. Part of your calling is not just helping the elite, being available to more people, which requires more staff, but requires organization so that you can actually keep things affordable. So that's a big part of this. So not only do you do the discovery call, you get right after that discovery call, you get all the prices up front, which I think not too many people do. Most people are trying to get you on a sales call before they'll even talk prices.
Well,
So
we'll actually share.
yeah.
I'll share a blog post where I link to all the prices and memberships we're currently offering, so you
Yeah.
can even look at them before you get onto a discovery call.
Absolutely.
Which is a big part of why I want to do this video today.
Yeah.
And
we want to make this process as easy for you and as easy for us as possible. That's why we're on here. This is educational, so to speak.
Yeah, and something that Jim said that I want to add to is that, we've both found, Jim used the word churn and burn the other week in a meeting in the gym world. He said there's a lot of churn and burn, and he's noticed this in the fitness world, that you'll get these gyms where they're charging X amount of dollars for a boot camp, for an intensive, and people, when they really break the numbers down, there's a lot of inflation in the price. And the reason is that, frankly, there's a lot of what we call customer acquisition cost. They are spending a lot of money on advertising and sales. I decided to take a different route with my practice and just make everything really simple and really upfront and really transparent. And just for the record, that model's actually kind of gotten brought into the functional and integrated medical world. And really, my philosophy and my passion in life is not, this churn and burn model of just one person in the door and one person out at a high ticket price. It's really taking great care of people for a reasonable, honest price structure, as well as not compromising the quality of the care by reducing the amount of service that we provide, because I do see that happening. And one of the reasons why we do the practice membership evaluation as well is that, Jim mentioned elite level people. We've got CEOs and very high net worth people who are actually on very affordable plans because they're frugal minded and they don't need a lot of work. They don't need a lot of maintenance. They're very well, they're healthy, and those plans are appropriate for those people. One of the reasons that I don't just let anyone off the street book a program or a membership like that is that if you are not reasonably healthy, if you are not at a certain level in your well-being, if you don't have a certain literacy of how to be healthy, how to keep your health intact, how to eat, how to live, how to move, all these things, then for us to let you buy that membership, in my experience, is a little bit like letting someone with, say, size 12 feet buy size 10 shoes. The shoe company shouldn't feel good about that because they just lost a customer. And the person trying to fit 12 size feet into size 10 shoes should feel a lot of pain. So I want to avoid that for you, for us. I want you to, my goal is 100% customer or patient satisfaction. And the reason that I'm doing this is to be very transparent, very forthright, very honest with people so that they can just take a really clear look at what we're offering. And also, I wanted to give you this explanation so that you understand exactly why it's structured the way that it's structured, because I don't think people understand really what it takes to get well. And I'm going to share a blog post in a moment that actually has links out to 2 other webinars I did on these topics. One of them is The Secret to Great Results in Functional Medicine and The Problem with Modern Medicine Revealed. Those are available on my YouTube channel. They're each about an hour, hour and a half. And they're really valuable for you to think about, review, chew on, and consider before you engage with any kind of functional or integrative medical care. So I want to share this blog post that I created to explain our programs and memberships. And I'm planning on maintaining this and adding new links. And basically, I just go through exactly why I created them the way that I created them. You've got these 2 links out to the YouTube videos on those 2 webinars that I mentioned. And then you will actually have links in here to a detailed explanation of our programs. You can even see what the going rate here is for staffing costs in functional medicine. So I didn't make up our fees out of the blue. And you can actually see exactly what our programs are. And it's actually an itemized Google Sheet. You can't modify it, obviously. You can't comment, but you can see exactly what you're getting in terms of hours per program or per membership per member of the practice. And if you ever have questions about why each member of the practice is included in a program, we're happy to review that either on a discovery call or a practice membership evaluation. But believe me, I really worked hard to give people exactly what I thought they needed. Something else I want to let people know is that we're not a la carte fee-for-service practice anymore. We are a membership-based practice. And so the benefits of membership include 20% discounts on supplements and up to 80% discounts on lab testing. That varies with the lab, as you can probably appreciate. And the reason why I did this is that I really didn't want to be running a practice that was essentially a, what's the word I'm looking for? I didn't want to be a fireman anymore. Because what I noticed when I was doing concierge, high level, over $1,000 a month retainer style medicine, is that everyone was calling me when they were basically on fire. And that's not a sustainable model for practitioners. They tend to burn out. It's also not really good for patients. We want you to engage with us in an ongoing relationship so that we can keep you healthy, hold you accountable. Jim, really, his membership model at his gym is more and more what we've created at this medical practice, because, Jim told me the other day as we were going over this, he said, I kept my prices reasonable so I could keep people in the membership, because I wanted to train the same person over and over and over again, because training them to train actually took some time. And I really enjoyed training them more once I'd kind of gotten through the onboarding process. Is that right, Jim?
That is correct. Could you throw that link in the chat?
Yeah, I can do that. Another thing that you'll get here is you can get a comparison of our programs and memberships. And what that comparison looks like, I'll just go ahead and open it, is a nice, easy to read table where you see the number of consults you'll get with each person, the number of group coaching calls, which are integral to success, chat support, everyone gets that, and then the labs and the supplements that you'll get. And you can also compare the prices, which of course are subject to change because this is life and prices change.
The government prints money. That's why.
I know, the government prints money, so we have to raise prices. We're sorry, we can't control that. So I think that's a pretty good overview. If you want more information, I encourage you to go read that post in detail, because it's where I break down exactly why I set them up the way that I did. I also encourage you to go watch those 2 webinars. They're brief. Well, they're not brief. Compared to the amount of time, let alone money, let alone the investment of your vitality, essentially, in medical courses, programming, et cetera, that you're likely to make over the course of your life, reviewing those webinars so that you understand what's going on in functional medicine is an it's an excellent use of your time, which is why I made them. So I think that's enough. Jim, anything you want to add?
Well, it was really interesting when I had my gym model. I thought that once people learned how to train, they would just stop coming, but that was the furthest thing from the truth. They actually really enjoyed the process more, because then they got to have input in that process.
Yes.
And then also the accountability factor and the community factor. That's where the group coaching calls come in. We've got people that really enjoy getting on the calls and getting to know the other people. And then, if you do have a setback, it's a lot easier when you have someone to gently remind you to get back on course than it is to call when your house is on fire, right?
I see that happening all the time.
Yep.
I see someone coming into a group coaching call. I go into their chart as they're talking to me. I'm listening to them, but I'm also checking up, and I'm saying, we really need to get on, and this is in my head, I'm thinking, we really need to get on top of this or on top of that. And then I'll email a member of the team, hey, can you go check in on so-and-so, because I see this thing that's still out of range on their labs, say, or that isn't followed up from 6 months ago. And that allows us to then really take great care of people, get them great results, keep them on track. And I think that's one of the things that sets us apart. And like I said before, their churn and burn model is becoming very normal in the functional medicine world. And it's great that people will come in ready to activate and change and achieve great things and lose a lot of weight and all that. But I saw people then leave those programs, not have anyone to hold them accountable, not have anyone to check in with. And their only recourse was essentially very, very high ticket, high intensity programs. And our programs are, they're expensive because they're all inclusive. We include labs, supplements, and consultative time every month. And, for that price, it's over $1,000 a month because everything's included. So you get a huge value. Yeah, and like I said, you can go review the prices in detail. Yeah.
Well, the programs are a little more expensive because they're very intense. Everything's included. But once you get through that and you get into the memberships, then it's a lot more reasonable, because then
Absolutely.
you don't need as much care, you don't need as many supplements, you don't need all the rest of those things. So it's a
That's right.
it's a nice balance.
Exactly. And that's why we created it, because we want to be a place where people can come and reclaim their health if they've got a really serious medical issue. But we also want to be a place where people can get reliable medical care year after year to just make sure that they're still in optimal health and that they're not headed in the wrong direction in any way, which I see happening all the time. I mean, it's very common for someone to come in who thinks that they're in pretty good health. And we find that some incredibly important marker that has a lot to do with their longevity and vitality is actually quite out of range. And we have to make significant diet and lifestyle changes to bring that back into the appropriate ranges. So,
Well, I think the big part of this too is the community aspect of it. You know, I think a
we have
lot of
done that
people
very
they
valuably.
get on these group calls and they hear about something someone else is struggling with, or you know how they've approached it, or some of the struggles they're going through. Not only are they able to give feedback, but they're able to learn from the process, and they're able to hear the process over and over again. And people really get to know each other. There's a lot of people, you know, that email back and forth. You know, they develop friendships and relationships, and I think that's a big part of why this is so important, because as things get loopier and loopier, having like-minded, reasonable, rational friends is going to be very, 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 very important.
And being able to jump on a group coaching call with me and ask me a question that only takes me 5 minutes to answer, rather than waiting 2 or 3 months to schedule a 30-minute consult for that 5-minute question. We'll also see this. We'll see this as well. We'll see the nurses getting a chat message. They bring that to me at the end of the day. I'll respond, and then they'll go back and answer that person within 24 hours. So that's how we've set it up, and that's why it's such a value, what we've created. It allows us to communicate with you efficiently, effectively, while also providing an exceptional quality of care.
Well, it also keeps you from having to do 1,000 emails, which I know you love doing that. So,
Yeah, I mean, I don't think people realize part of why medical practices have made the doctors and nurses and clinical staff so inaccessible behind a receptionist or front office staff who don't really often aren't equipped to answer questions, is that because they're on this fee-for-service model, they're basically, their front office staff are an expense. And the reason that they aren't helpful in answering people's basic questions is that there's no mechanism there to pay them. But with memberships and programs, everything's all inclusive. So I built in the time for us to spend time answering your questions as efficiently and effectively as possible. So you're not out there wondering, well, for 3 months or something like that, well, how good is this protein powder for me? Or can I take this supplement that I didn't have time to talk to Dr. Stillman about in my consult 2 weeks ago or whatever? So that's what we've set up. We look forward to taking care of many of you watching this video. Any closing thoughts, Jim?
no, it's great to be able to get on here and explain this all in a simple manner. And you know, that's I think is the number one challenge, is the admin side of things, and then getting people onboarded. Is the
Yes,
challenge, you know, and we're
absolutely.
doing the best we can to make that more efficient.
Absolutely. So thanks everyone for watching. Take care. Have a great day, and you can apply for consultation at stillmanmd.com.
Make sure you get outside today.
Get outside. Yeah, it's good for you.